Imagine this. A new bundle of fur has just arrived in your home. You're marveling at their tiny paws, listening to their first delicate squeaks, and then you notice it, a small gap or a split in their upper lip. In that moment, any owner's heart skips a beat. Your mind starts racing with frightening questions. Is he in pain? Will she be able to eat? Did I do something wrong? And what happens next? Please take a deep breath and don't let panic take over. Today we're going to talk about why a cleft lip, or what we call a special smile, is not a death sentence. In fact, it's often just a unique brushstroke in the portrait of your beloved companion. We're going to break it down, cell by cell, to understand how this trait occurs, whether surgery is truly necessary, and how to ensure a kitten born this way lives a perfectly happy life. Understanding the biology is the best antidote to fear. When we pull back the curtain on the mystery, the problem stops being scary. Let's start with the basics. What exactly is a cleft lip? In the scientific world, it's known as cheiloschisis. It's a congenital anomaly where the tissues of a kitten's upper lip don't fuse together properly during their development in the womb. Think of a kitten's growth as a complex, high-speed puzzle. At a very early stage, two pieces that were supposed to meet and form the upper lip simply missed each other in time or space. It's essentially a glitch in nature's timing. The tissues just didn't join at the designated spot. The result is that gap we see. It's important to understand, this isn't an injury, it's not the result of a fight in the womb, and it's not a disease in the traditional sense. It's an architectural hiccup frozen in time. For the kitten, this state is perfectly natural from birth. They don't feel like something is wrong with them. For them, the world began with that exact smile. But like any natural quirk, this feature has its variations. Most often, veterinarians see what's called a unilateral cleft. Interestingly, nature seems to have a preference for the left side. Left-sided cheiloschisis is the most common form. Occasionally, we see a bilateral cleft, where the gap is visible on both sides of the lip, but that's much rarer. Usually, the edges of this gap are perfectly smooth, healthy, and show no signs of inflammation. The kitten doesn't feel any pain when you touch the area. It's a bit like if a tailor forgot to put a couple of stitches in a very expensive suit. The fabric is fine, the style is great, but there's a little bit of unintended ventilation. However, there is one critically important nuance that every owner must know. A cleft lip should never be confused with a cleft palate. While the names sound similar, they are two very different stories for a kitten's health. Why does this matter? An isolated cleft lip is, for the most part, a matter of aesthetics. It almost never interferes with a kitten's ability to nurse or eat. But a cleft palate is a gap in the roof of the mouth. This is a serious threat because during nursing, milk can travel into the nasal passages and down into the lungs, causing severe pneumonia. This is why, if you notice a split lip, your first and most vital step is to have a vet check the kitten immediately. The vet won't just look at the lip, they will thoroughly examine the roof of the mouth to rule out hidden risks. If the palate is intact, you can breathe a sigh of relief. Your kitten is just a little unique. Now that we know what it looks like, let's go deeper. Where does this come from? A cleft lip is usually the result of a complex dance between genetics and the environment. The primary cause is hereditary, following what scientists call an autosomal recessive mechanism. In plain English, it's a sleeper agent situation. Both parents can look absolutely perfect. They might be show champions with flawless features. But if both carry this hidden gene, they can produce a kitten with a cleft. It's not the breeder's fault, it's a genetic lottery. But biology isn't just about genes. Sometimes external factors during the mother's pregnancy can trigger the glitch. The list is quite broad. For example, nutrition plays a huge role. Both a severe lack of folic acid and vitamin A, or conversely, an overdose of retinol, can affect fetal development. Certain medications, like specific antifungals or antibiotics, can also interfere if used without strict veterinary supervision. Even intense stress, environmental toxins, or an accidental injury to the pregnant cat can, for a split second, disrupt the delicate fine-tuning of a developing life. This is why peace and quiet and a royal spa treatment are so important for a pregnant cat. We should also mention those who are at higher risk simply by birthright. Statistics show that certain breeds are more predisposed to this anomaly. Keep an extra eye on Persians, especially the ultra-typed ones with very flat faces. You'll also find ragdolls, Abyssinians, and Siamese cats on this list more often than others. When we breed for specific head shapes, we inevitably make the process of embryonic development more fragile. So the kitten grows up. How does this affect their future? Keep this main thought in mind. An isolated cleft lip is not a sickness, it's a cosmetic feature. It doesn't cause pain, and it won't stop a cat from living a long, vibrant, and active life. A cat with this special smile will behave exactly like any other cat. They will chase laser pointers, get the midnight zoomies, and demand breakfast at 5 a.m. There are only two real limitations, and they are mostly ethical. Cats with this trait cannot participate in professional shows, as it's considered a breed fault by standard. More importantly, these cats should be spayed or neutered and excluded from breeding programs. This is a responsible approach that ensures the trait isn't passed down to future generations. If your cat is a companion just for the soul, these rules won't affect your happiness together at all. Nevertheless, many owners consider surgery. Is it necessary? It depends. Plastic surgery or cheiloplasty is most often done for aesthetic reasons, to restore symmetry to the face. But there are times when it becomes medically necessary. If the gap is so large that the cat is constantly traumatizing the area, or if food gets stuck in it causing chronic irritation, a surgeon will recommend the procedure. It's important to know that this surgery is never done on newborns. You have to wait until the kitten is older, heavier, and their tissues are fully formed, usually not before 4 to 6 months of age. This waiting period makes anesthesia safer and the results more predictable. Before surgery, the kitten gets a full workup: blood tests, heart checks, and a consultation with an anesthesiologist. Modern veterinary medicine allows for very gentle correction using techniques like the Z-plasty, which minimizes scarring under the fur. Post-operative care will require some patience. Soft food, a protective cone, the cone of shame, and regular cleaning are a small price to pay for your pet's future comfort. But even without surgery, many cats with a cleft lip feel absolutely wonderful. Can this be prevented? The foundation of prevention is responsibility. If a kitten is born with a cleft, it's a signal for the breeder to reevaluate their breeding pair. And for pet owners, the main thing is to give the expectant mother a stress-free sanctuary. A balanced diet, a calm environment, and 0 medications unless approved by a specialist. These simple steps minimize the risks. In closing, I want to say, don't be afraid of the different. A cat's life with a cleft lip can be completely full and joyful. It doesn't require Herculean efforts or special medical skills from you. The most important thing is to get a clear diagnosis from a vet early on to rule out hidden threats. Remember, your pet is unique. Their little feature is just part of their individual charm. Cats don't love us for our perfect features. They love us for the warmth of our hands and the kindness of our hearts, and they certainly deserve that same unconditional love in return. If this story helped you understand our amazing feline friends a little better, please don't forget to hit the like button. It helps us create more helpful and heart-centered content for the community. Tell us in the comments, have you ever met a cat with a special smile? How did their story turn out? We always love reading your experiences. May your cat stay healthy, and may your home always be filled with the sound of happy purring. See you in the next video.